Good morning, most respected Krishnamarji, distinguished scholars, dear delegates. The topic is diagnostic approach to Amavata and Vata. See, in Ayurveda, there are major joint disorders where we are always finding it difficult to diagnose and then go for the treatment. One is Amavata and next being the Vata. There may be so many correlations, but I am not going to the correlations. Only on the patient's language, how you can diagnose Amavata and how you can diagnose Vata. Okay. See, clinical evaluation in Ayurveda, the basic tool we are applying is Trisutra. You know, whatever be the clinical condition, we have a uniform protocol, that is Hetu, Linga and Aushadha. Hetu means the etiological domain, what are the causes behind the disease. Linga means the symptomatological domain, what are seen in the patient. And finally, Aushadha, how the patient is getting benefit by the treatment. So, based on these three basic tools, we are going to evaluate Vata and Amavata. So, we are going to apply the same principle of Trisutra to diagnose Amavata and Vata without any bias. Okay. Coming to the diagnostic criteria, to make it uniform and free from any bias, I divide the entire criteria into 5 categories. Not only the symptoms, Ayurveda always considers that disease is the product of a finished samprati. Yatha dushtena doshena, yatha jani visarpada, nirvritti ramayasya. So starting from the contact with the etiological factor, the disease starts. Okay. So the first criteria in the diagnostic procedure is nature of etiological factors. The second being pattern of joint involvement. Third being involvement of main and associated dosha. Fourth, involvement of dusya, and finally nature of articular and extra articular features. So based on these 5 criteria, I am going to diagnose how we can diagnose Amavata and Vata without any overlap. Okay. So coming to the Amavata, what is the disease? The first question, Amamcha Vadam Amavadam. It is very simple, a rheumatological disease with a definite involvement of Ama in the pathogenesis. You very well know, whenever there is an inhibited digestive activity, whenever there is a suppressive biological fire, whenever there is an infective episode, in all the condition, there will be Ama. So Ama denotes a condition where there is inhibited biological activity in the body. So Amavata is a rheumatological condition, joint disease with a definite involvement of biological fire inactivation. Coming to Vata, what is the disease? The same question. Asrajo Yutha Vayu Vata Shonidam, Vadena Avradam Shonidam Vata Shonidam. It is very clear that Vata Shonida or Vata is yet another rheumatological disease with definite involvement of recta vitiation. According to the modern pathology, we can very well tell that whenever there is an inflammatory event in the body, definitely the main structure to be affected is recta. So without recta dosha, there is no Vata. So Amavata, the key pathological factor is Ama or Agni, and in Vata the key pathological factor is recta. In both you are getting the common factor Vata. Okay. So coming to the nature of etiological factors, let us examine in Amavata the causative factors which lead to the formation of Ama in cells and tissue. I mean, whenever you are getting the accumulation of Ama in a cell or tissue, it is nothing other than any type of endotoxin, maybe the product of any infection. And most of the cases in Amavata, you are getting a Kapha Vata axis of causative factor. My dear delegates, please pay attention. Whenever there is a Kapha vitiating factor, there will be always loss of movement because Kapha is Stira. So whenever there is a Vata related pathology, again there will be difficulty in movements because Vata is responsible for Chaya Guna, movement. So a Kapha Vata axis of pathology will be leading to Amavata. And the risk group of Amavata include Mandagini. Mandagini means those who are having low digestive fire, maybe constitutional or occult, and sedentary lifestyle. And third is very important, habit of indulging in activities immediately after food intake, which will also cause Agnimadhya and Ajirna. So Ayurveda always recommends that whenever there is a Vata Prakopa reasons before a Kapha event, it will be leading to Ama formation. And Amavata specific causes, because I am telling you the etiological factors are always giving vital help in making the true diagnosis. Okay, so the specific causes of Amavata include exercise after oily heavy food. Oily heavy food will lead to Kapha Prakopa, and after Kapha, if you are indulging in exercise, which is yet another reason for Vata, it is a very important causative factor. day sleep definitely aggravate ama and kapha dosha. Suppression of urges will definitely vitiate the vata. Excessive consumption of underground tubers like potato, tapioca, again vata prabhava. So finally, viruddha types of food articles which will totally have a systematic effect on ama. That is very important. A systematic impact of ama in almost all the cells. That will be the specific etiology for amavada. Coming to the nature of etiological factors in Vata Rekta, you can see the causative factors leading to vitiation of Rekta in the body, specific Vata vitiating factors with the domination of cold. Rightly told by the previous speaker, my teacher, every time whenever there is exposure to cold environment, there is always the possibility of a Vata Prakopa, especially in Vata Rekta. Coming to the risk group of Vata Rekta, the tender persons, not who are not having that much of exercise, less active, physically less active, obese personality, and improper traveling with the hanging of legs for long time. That is a very important pathology. Dear doctors, according to Ayurveda, Vata Rekta is not a mere locomotor pathology. Vata Rekta is inclusive of vascular anomaly. So whenever there is a hanging of legs for long time, there is all possibility for getting a Vata Rekta in terms of vascular involvement. Coming to the specific causes of Vata Rekta as told in the science, the liquid food, especially alcoholic or fermented drugs, we call them Vidahi and Viruddha. Curd, buttermilk and similar food items which will cause Rekta Dushti in the body, and Vidahi, Viruddha are generally having a background etiology for Vata Rekta. So coming to the initial symptoms, we have seen that in Amavada, digestive fire and Kapha-Vata axis. In Vata Rekta, inflammation, Rekta Dushti with Sida Guna of Vata. Now let us come to the initial clinical features of Amavada. Heaviness of the body, swelling, generalized body pain, reduced appetite. You can see all the time a Manda Guna is dominantly playing behind the curtain. So that is the initial symptom of Amavada. Coming to the Vata Rekta, similar to skin disease, because the Rekta Dushti is playing the important role. Discolorations in the skin, burning sensation, numbness, itching pain. So you are getting more dermatological features plus rheumatological features in Vata Rekta. Coming to the pathological factors or Samprapti Khadagas in Amavada, we can see a Tridosha dominant pathology, that is dosha. Vata may be Samana Vata, Apana Vata and Vyana Vata. Dusha is predominantly Rasa. All the Srodasas like Rasabaha, Udagabaha, Annabaha, Purishabaha. Agni will be always Manda, and Adhisthana, site of origin is Amashaya and site of manifestation is sites of Kapha dosha. That is most important thing. The disease originates from Amashaya, the site of Ama. The disease manifests in all Kapasthana including joints, Amashaya, Kanda, Uras, etc. Coming to the pathological factors in Vata Rekta Samprapti, the Tridoshas are mainly involved with the definite Vata domination. Dusha mainly Rasa, Rekta, Mamsa, and as the disease progresses, you are getting the involvement of all the Dhadus. That is what is called Kalantarena Embrium. So Srodasas are like that only. So coming to the diagnostic criteria for Amavada, which mainly include all the GAT features: Andamarta, Ariji, Trishna, Alasya, Gaurava, Jara, Apaga, Angashrinada. Need not explain. All these clinical features are supporting the involvement of GAT, Agni and a possible Ama in each and every biologically active cell. So that is the story behind Amavada. So features involving GAT and joints. Coming to the increased Amavada Lashana, you can see Agni Dorbalya, Prasega, all the systems will be suffering with the Ama. You are getting a hypofunctioning in physiology with the severe joint pain and all pathologies including the heart. Okay, so I can tell you features involving GAT, joints and heart are the clinical features seen in the later stages of Amavada. Coming to the Amavada features based on dosha domination. If it is a Vata dominant Amavada, pain, constipation, abdominal pain. These are I am telling from the clinical experience. In Pitta dominant Amavada, which is very rare in the clinical practice, you are getting burning pain, readiness and fever. In Kapha dominant Amavada, swelling, stiffness, heaviness and itching. These are the basic diagnostic features. So in short, I am concluding the Amavada. Amavada has GAT and locomotor manifestations, cardiac involvement in later stages. Ama is the basic pathological factor and Kapha Vata axis of disease. So these are the important points which are to be kept in the mind while diagnosing Amavata. So coming to Vata Rekta, it has got two presentation, acute presentation that is Uttana Vata Rekta and Gambhira that is the chronic presentation. Okay. Coming to the Uttana and Gambhira, the picture very well suggests the first being Uttana where superficial clinical features are seen with the swelling, redness and erythema. So when you are proceeding to the Gambhira Vata Rekta, you are getting deformities with the total destruction of the joint capsule. And you can again see the normal X-ray will be telling without any subluxation. When you come to the Gambhira Avastha, you are getting all the Vakrata and the dislocation. Pindantimal Erathyandar Vakri Purvamscha Vedavan can be identified in the X-ray. So Gambhira Vata Rekta is a chronic deformed arthritic condition. Coming to the Uttana, the clinical features, Kandu, Tok, Daha, Duk, Ayama, Toda, all are superficial clinical features. Features involving mainly the skin. And Gambhira, you know, the clinical features are severe pain in joints, inflamed swelling and development of deformity. So we can very well distinguish the Uttana is the acute superficial stage with the recta domination and Gambhira is the chronic deformed stage with the Vata domination. Okay. Coming to the key points of Vata Rekta, more localized symptoms are present, integumentary and musculoskeletal systems are involved. In some cases, vascular abnormalities are also present. Rekta margam nigantyashu shaga sandishu mayuda nivisya manyonyamavarya vedanavar characterisun is very well telling that Vata Rekta is not a mere joint disease, it is a vascular phenomenon also. And coming to the dosha based differences of Vata, Pitta, Kapha, we can see all pain features in Vata, all inflammatory features in Pitta and all stuffiness, heaviness in Kapha. So this is the different pictures. In the first you can see the Vata domination, on the right you can see the Pitta dominant, the red coloring and the very chronic Gambhira Vata Rekta with the deformity. So I am telling you the progression and prognosis, it is always remission and relapse is notorious for Vata Rekta. Now I am concluding the presentation with a definitive OPD consultation. If a patient is coming, first involve the types. If bigger joints are involved, it is Amavada. If smaller joints, it is Vata Rekta. Amavada, it will be Ama will be present throughout, and systemic is Amavada. Vata Rekta is local, and swelling in the joints is Amavada. Amavada, Jwara may be present. Vata Rekta, no fever. So Amavada, systemic involvement with the GIT. Vata Rekta with integumentary, vascular, and musculoskeletal. So finally, do the Upashaya, Lenkhana, Ushna, Ruchana will be Upashaya in Namavada and Upashaya with the Rekta Moksha Vadakara in Vata Rekta. So this is the last word. Resavaha involvement in Namavada, Rektavaha involvement in Vata Rekta. Uttana is having skin manifestation, Amavada is having cardiac manifestation. Vata Rekta is responded by Rekta Mokshana and Amavada by Lenkhana Jigilsa. So that is my word. You can replace the joints and it will be giving mechanical movements. And you can give Ayurvedic Vata Rekta Chikitsa which will give a 360 degree of movement. So select which is good. Wishing all clinical success. Thank you very much. Thank you.